video, I will be doing tracheostomy care on my patient. I have reviewed the chart and verified that it is the right patient. Hello, sir. My name is Hong Yang Lin. I'm a student nurse. Today, what I'm going to be doing is I'm going to be doing tracheostomy care. That includes pre-oxygenating you and then using a suction catheter to suction out the mucosal secretions, and then I will be changing the green disposable inner cannula and also changing the dressing. Is this all okay with you? He says yes, it's okay. Throughout the procedure, I have my mask on and I have my gloves on, and I continually maintain aseptic technique. The first safety check consists of making sure that all the equipment is working. Firstly, I will make sure the oxygen is working. My oxygen is working. Secondly, I make sure that my suction is working. It is within my desired range of 80 to 120. Sir, before I suction you, first thing I will do is I will attach a sat phone monitor and I will be monitoring your heart rate. I will put oxygen on 98%. At 10 liters per minute. There it is. 10 liters per minute, and I would make sure to adjust this to 10 liters per minute, and I would have it there for 30 seconds. Sir, please make sure to take 2 to 3 deep breaths. And then this is the pre-oxygenation portion. So 30 seconds has gone by. I will now here you go, sir. And now I will get the suction tubing. So just by looking, this is size 7 of the DIC, and formula is 7 minus 2, 5, multiplied by 2, 10. Size 10 French suction catheter. It is at 100, which is between 80 to 120. The first 5 inches must remain sterile. still at 100. My thumb isn't attached yet. It has reached the end, and now for 15 minutes I've performed intermittent suctioning, twisting, twisting, and the whole process takes 15 minutes. While I'm doing this, I'm also continually monitoring his O2 saturations. This goes in the garbage. With my sterile water, this way I would keep going until the tubing runs completely clear.
There's not very many people left though. One left from there.
The mistake that I made that I could have done better was at the start, I made sure that there was the oxygenation and there was the suction tubing working. I forgot to check the tray. What I want in the tray is extra tracheostomy ties, my extra DIC, disposable inner cannula, a yank tower suction, and also extra trach ties, and the trach dilator tool, which would be in here, but we looked and there truly wasn't one. But in real clinical setting, we have to have one. Sir, I'll help you now with your changing disposable inner cannula. Using sterile no-touch technique, and I will gently put the new disposable inner cannula in.
Have a good week, guys. Thank you so much for the chocolate. And you know they're
I'll be very gentle. And now what I will do, I have already have my sterile field set up. And the first step is to remove the old IV drain sponge. The tissue is granulation tissue healing. There's no drainage on the side and there's no mucus. I do the bottom, and now I do the very top. That has a touch, so it's broken sterility. And now I will get a, this right hand has also broken sterility. I will now get a dry one.
You know what I mean?
Since this is still sterile, I think I might use this. And the last step is I will use the IV drain sponges, and using a sterile no-touch technique, I will be putting it on. And in real clinical practice, I will make sure to have further practice to try to clean as close to the stoma of the patient as possible. That way, I would be able to get all the mucosal secretions on the peristomal area if there happens to be any. Thank you, sir. I will be cleaning up my things and I will do my exit safety check as well. And I'll continue to monitor the O2 sats and the pulse.